And I'm very pleased to welcome back to the show Paul Seegert, who is managing partner at PCS Advisors. And PCS Advisors does health benefits consulting, and they've got dozens of partner offices all around the country. And Paul has been on the show before. And I got a few things I want to talk with you about today, Paul. And I have no idea where this is going to go. I think you and I are generally on the same page on economic principles. And so a couple of things that I saw that, you know, your opinions on some stuff struck me as interesting, and I wanted to talk about them. So welcome back. It's good to have you.
Thank you for having me.
So you had made a comment, or at least, your folks sent me a thing where you had made a comment expressing some, I don't want to put this too strong. Let's say skepticism or concern or something about the use of high deductible healthcare plans. And this may have been particularly in the context of medicines that are getting very expensive. I've always loved the idea of high deductible healthcare plans in the sense that if you make people pay more attention to how much they're spending on healthcare, then they won't overconsume it. And I bet you agree with me on that. But so what's your issue here? Well,
it's a buyer beware situation, but we definitely need to become better consumers of healthcare. Our system is trained and really wants to train us not to be good consumers so that they can continue, the system can continue to increase costs in a somewhat invisible way behind the scenes that get buried in premium. But the risk that people face with these plans is that some of them don't cover anything, including prescription drugs, until you meet a pretty significant number. A few $1,000s, it could, let's say $3,000, it could be more, could be less.
Yeah.
And
by the way, Paul, are you on
maybe aren't aware of that.
Are you on a speakerphone or something? Do you
Let me see if I can get better audio for you.
Yeah, that would be good.
How's that?
Oh, that's much better. Thank you. And by the way, I'm on the kind of healthcare plan you're describing. So you're talking about me. So keep going.
Yeah, it's a great fit for the right people. It would be a great fit for me. I don't have chronic health conditions, and I don't take medications, and I eat pretty well, exercise every day, all that kind of stuff. So for, I would say 80% of the population or so, it's a great choice. And then there's others for whom it wouldn't be a great fit necessarily, depending on their consumption of healthcare, especially around drugs. If they're on an HSA style plan that doesn't cover drugs till they hit a few $1,000s, well, they might want to pick a different plan and pay a higher premium and not have to come up with $3,000 right out of the gate at the beginning of the year. And then a lot of them pick those plans for lower monthly premiums or payroll deductions, and then they'll realize after the fact, oh boy, I didn't realize that my drug isn't $20. My copay was $20. The drug could be a couple $1,000, or whatever the number is. And actually, I think it brings up another good conversation or point, which is we've got runaway costs in healthcare because we don't have free market forces in healthcare. And you can't be a good consumer if you don't know what things cost.
Right.
You don't have quality information and cost information. And it's not for lack of technology or ability to put that together for people. It's that it's not really in the industry's interest to do so.
And we're going to talk about a lot of that stuff. I agree with you completely on that. Let's just finish up, though, on the high deductible health care plan kind of thing. Yep. It seems to me that what's going on more and more in the world of health insurance, and entirely in the world of dental insurance, which isn't really insurance anyway, is that it's not as much functioning as insurance as it is functioning as just prepaid health care. And you're just paying so much every year. It's real. It would be as if you bought a car insurance plan that included wiper changes and brakes oil changes and maybe even gasoline, where the insurance company knows you're going to be spending all this money, so they just charge you all that money. There's no free money.
That's right. Yeah, it's not insurance. You're exactly right. It's consumption. It's just it's healthcare consumption prepaid, and that's not insurance. I use that very same example that you used around car insurance all the time, and it really makes people stop and say, hold on, that is true. No wonder it's so expensive. It's paying for things that we should probably just pay out of pocket for and be a good consumer about and get some good information around and so on. That's how we structure it for our company. Our employees have the option, at least, to pick a plan that's very catastrophic and only kicks in if something major happens. And I present as a cash payer, and I have essentially individual reinsurance on big losses for my family. I've got 5 kids, and I've got a broken arm this year. I've got a perforated eardrum this year. I got a hernia in the last 12 months and had to get it repaired, and I never had to spend more than a couple $1,000 per instance because I had reinsurance basically that would kick in. And we don't have chronic conditions, and we don't take medications other than, okay, my son had a perforated eardrum. He needed antibiotics. That's the right time to use those so he doesn't have hearing loss. Well, that's very inexpensive. We have no problem going to the pharmacy on the corner and shelling out $30 or $40 for some antibiotics.
Yeah. So is that reinsurance kind of thing something that's available to the general public? Is it a very specialized product?
Absolutely.
What is that?
No, absolutely. Yeah, it started out as religious kind of medical cost sharing programs.
Oh, yeah, I've heard some of those ads.
Yeah, and they've evolved into more than that. There are some companies out there that are not religious based that are set up for employer plans that are have been started by doctors, actually. A doctor out of Texas started a great one, and he was just fed up with the way the insurance payment model works. So he started up a company, 2 companies, one to do the medical, that form of coverage, and then another one to negotiate claims. And has put together, I think, a really great model. We pair that with some telemedicine, direct primary care, and some drug coverage. It works for most people, 80 to 90% of people. It's great. And I went from paying, years ago we made the switch, but even years ago, about 3, 4, 5 years ago, I was spending north of $20,000 a year for a high deductible plan for my family. Because even buried in my premiums, I have to help cover all those people who are using it more like consumption coverage. And so if you really are just buying the coverage you need, and you're of the 80 or 90% of people who don't use a lot of health care, my costs went down to 40% of what they were.
Remarkable.
And my out-of-pocket risk went down to a fourth of what it was.
Wow. We're talking with Paul Seegert of PCS Advisors, pcsadvisors.com. And maybe you got a business where it'd be helpful to talk to Paul's firm and see if they can help you with this stuff. I actually got another email from, one of these guys who tries to get you out to the media, and very interesting topic this morning that about the price cap on insulin. And I think a lot of people believe that if the government says insulin only costs $35, then insulin only costs $35. Now, for the record, insulin should probably really only cost $5 or $10. It is an old drug that is not that difficult to make, but the market has gone the way it's gone. And as you noted, we really don't have a free market in healthcare. But I'm a guy who loves Bastiat, right? That which is seen and that which is not seen. What is the unseen effect on millions and millions of Americans for insulin being quote unquote capped at $35?
Well, it's going to result in higher premiums and higher cost of insulin, and I'll explain why. You've got a couple of the key factor is when all you have to do is read these laws that they propose and pass, which, believe it or not, I do. I'm a sicko. And you go in there and you see they're only capping the copay. When they cap the copay, then what happens to the rest of the cost? Of course, it has to be covered by insurance. And when it gets covered by insurance, what happens to the cost? It goes up. When COVID tests were no longer being purchased independently by the government and were pushed into health plans, they went up in cost. Because when the consumer won't see it, they just raise the price. And so this will lead to higher cost of insulin without question. And when they pass a rule like this that protects a subset of the population of people that use drug, half the people that use insulin are under the age of 65, and then you're squeezing a balloon. It's just like when someone with Medicare or Medicaid shows up at a hospital and the hospital loses money on that transaction, they turn around and bill the person who shows up with coverage from work more. 224% more if you believe the RAND Corporation study that came out a few months back. We do our own analysis, and we see it anywhere from 3.5 to 12x what they charge. Those hospitals will charge what a Medicare and Medicaid person pays or their plan pays for the same procedure at the same facility. So it just pushes cost in the way that they often do it. And, the biggest lobby in the world is healthcare lobby.
Okay,
That's how these things come about.
So insulin has gone up like 10x in price or something in the last 20 years, and epinephrine, like the quick shots in your leg for if you got an allergy to bees or eggs or peanuts or whatever, has just absolutely exploded in price. And these are drugs that they're not under patent, they're easy to make, they're cheap to make, and if there were an actual functioning free market, these drugs would be really, really cheap. So
That's right.
how do we get to a place where there's a functioning market and insulin is $35 because it's really $35, not because there's a price cap, and
Right.
the epinephrine shots are $20 instead of $200 or whatever.
Yeah, price controls is not the answer. Free market forces are the answer. We know it to be true. We see evidence throughout our system. Look at the cost of LASIK and the quality of LASIK. Quality's gone up, cost has gone down over time because it's for the most part a cash procedure. Same with cosmetic procedures, same with that kind of stuff. So there's evidence that it absolutely works to drive up quality and drive down costs like it does in so many other areas of the economy. What we need are some common sense rules around transparency. I mean, the function of government isn't to control the price, it's to create some guardrails to set the rules of the game. And we need to look at those rules again because we're giving in how they're able to be perverted, perhaps. Should drug companies get a period of exclusivity? Yes. We're responsible for 80% or north of that of all medical innovation in the world because we reward it. So that's a thing. Allow them to pack it around drugs. Every time they also use it for this, and then they keep adding time to that activity, almost in endless way. We just saw Humira, the most commonly prescribed specialty drug in this country, which has been a generic in Europe for $300, $400, $500 for years. It got as high as $60,000. The drugs went way past what would be the normal period of exclusivity, but they just keep protecting it, and we allow that.
Wow. Well, why insulin though? Why is insulin? Why are epinephrine? Why are they so expensive? They're not. I mean, I know people are making slightly different versions of insulin in particular, and then claiming some protection there. But someone could make the regular old insulin. Why aren't they?
Right. Well, people get paid not to, believe it or not. We allow that, say we allow it. It may not be technically allowed, but it goes on.
Yeah.
And then you get a little slap on the wrist. I think drug company out of Switzerland, the names escape me right this minute, but they just settled another big settlement for doing that very thing, where they just go in and they say, hey, it could be a generic. We'll give you, $80 million not to release your generic.
Yeah.
And just sit on that for a while.
That might have been Novartis. I'm trying to remember.
Yes, you're right.
Yeah.
Yes, you're right. Yeah,
that's
and
so
globally they've done that to the tune of some $700-800 million in very recent history here.
Yeah,
for doing that kind of thing.
The penalties need to be so big that they never do it again. Because that is just. All right, we got to leave it there. We got so much more we could talk about, but I don't have more time, folks. If maybe your business needs this kind of help trying to figure out the right way to manage your healthcare costs, you can go to pcsadvisors.com. It's linked on my blog at rosskaminsky.com as well today. Paul Seegert is the managing partner there. Thanks so much for your time as always, Paul.